anterior.
Myself, Dr. Manojkumar Gaddikeri. My study is on comparative analysis of long-term outcome of anterior reconstruction in thoracic tuberculosis. The outline of my presentation includes introduction, aims and objectives, materials and methods, results and conclusion. Tuberculosis of spine was first described by Sir Percival Pott. Thoracic spine is the most common site affected. The anterior part of the vertebra is the most common area affected in the spine, leading to collapse and kyphotic deformity. The aims and objectives of my study were to retrospectively evaluate and compare the long-term outcome of anterior reconstruction of vertebral body in tuberculosis of dorsal spine by anterior versus posterior approach, for which we chose a retrospective study design consisting of 245 patients, of which 118 operated by anterior approach and 127 operated by posterior approach. The study duration was of 1 year. Clinically, the data regarding demography, neurology as per Frankel grading, approach used, surgical time, blood loss, post-op mobilization and complications, if any, were recorded. Radiologically, the patients were assessed by X-rays taken preoperatively and postoperatively at immediate post-op at 1 month, 3 months, 6 months, at 1 year. MRI scan, CT scan were done. Pre and post-operative corpse angle were calculated. Percentage correction of kyphosis, time to fusion, and loss of correction were recorded. The anterior approach was indicated in young patients with absence of comorbidities and those with 2 or more vertebral body involvement. The surgical technique involves versatile approach technique. The anterior reconstruction was done using cage, rib graft with or without iliac crust grafts. The fixation in all cases was done using hard-shell rectangle with sublaminar wires. Posterior approach was preferred in older patients with comorbidities and those with less than 2 vertebral body involvement. The surgical technique involves standard posterolateral approach via transfacetal, transpedicular or coastal transvasectomy approach. Cage anterior reconstruction was done by cage, iliac crest graft and with or without rib grafts. And the fixation was done in all cases using pedicular screw system. The results of our study showed the mean age of the patients was 36.3 years in anterior approach as compared to 39.8 years in posterior approach. The mean operative time in anterior approach was slightly longer of 6.11 hours as compared to 5 hours in posterior approach. Mean preoperative kyphosis was 41 degrees and postoperative kyphosis of 9.5 degrees with 77.46% of correction in anterior approach, which was statistically significant compared to 67.2% correction in posterior approach. The time to fusion was relatively less in anterior approach with 4.69 months, which was statistically significant compared to 6.34 months of posterior approach. The mean loss of correction in anterior approach was mere 6.18 degrees compared to 4.18 degrees in posterior approach. The mean time to mobilization in anterior approach was 2.51 weeks as compared to 1.18 weeks in posterior approach. The neurological recovery was slightly better compared to posterior approach in anterior approach. The complications, there were 17 complications in anterior approach, of which there were 2 dural tear, 7 suture set complications, 3 pneumothorax, 1 implant failure and non-union, and 3 neurological deterioration. As compared to 35 complications in posterior approach, where there were 11 dural tear, 10 suture set complications, 10 implant failure and non-union, and 4 with neurological deterioration. To sum up, the goals of management in TB spine includes thorough debridement and neural decompression, anterior column reconstruction and deformity correction, rigid stabilization and bony fusion. All this can be achieved better with anterior approach as compared to the posterior approach. From our study, we would like to conclude that anterior approach gives a better functional outcome and kyphosis correction compared to the posterior approach. Thank you.